So, good afternoon, everybody, and welcome to the next edition of the Carers podcast, Care to Speak. Friend of mine this afternoon and a neighbour. He's not quite close as a neighbour as he used to be because he moved away a little bit, but that's no reflection on me. Phil Dunstan, who I would describe as a carer extraordinaire. So, welcome to our podcast, Phil, this afternoon.
Thank you, Steve. Good to be here.
Good. I was very keen to talk to you because your experience of being a carer, to my mind, is quite unique. I mean, everyone's experience is unique, but I just wondered if you could share with everybody a little bit about your family situation.
Well, we're a family of five, three adopted children, although really I should be saying young people now. So a manufactured family, but one it's different because of having two boys with significant and different disabilities, but a very rewarding family because whatever you do in life, you're only going to get out of something what you put into it. And they've paid us back in many ways, 20-fold. It is just, we never thought that going into adoption, we would end up going down this route as far as we did. But it's surprising, actually, what you are capable of. I mean, I've had a background of caring because my late father broke his neck when he was 60 and became tetraplegic. So it's been a reasonably natural thing for me, but I've always been impressed with how my wife Lisa's taken to it because she's never had any direct connection with disabilities. But it's surprising. I don't think any of us know what we're capable of dealing with until we're in that situation. But obviously for us, it was a choice rather than something that landed in our laps. But I think that makes our situation significantly more straightforward than somebody whose birth children have disabilities. But that's only my opinion.
Why do you think that, Phil?
Well, I do think that at times parents that have children born to them with disabilities unnecessarily blame themselves. They carry, and I've seen that having been a provider of transport, special needs transport in the past with my own private hire business. I came across a lot of parents in that situation, and it's what I picked up on, and I think that's a sad situation because it's what life throws at us. It's nobody's fault, but in comparison to us, we made a decision to go down this route. So we've taken everything on board, eyes wide open, but it's still not an easy run. And there are many obstacles put in the way. Perhaps I shouldn't say put in the way, but they are put in the way, that makes life a lot more difficult than it needs to be.
What sort of obstacles?
Well, life is very complicated.
Mm.
I live by, I like to make things as simple and straightforward as possible because I just find life complicated and overcomplicated unnecessarily. I know that's a very idealistic.
We live in
approach.
2025. That's a fair enough comment.
But we live in a world where, well, even like today, I've spent quite a bit of time on the phone trying to sort something out with the council. And even now, I'm not 100% convinced that the person I was talking to, although she was really lovely and tried to be helpful, she turned around and said, well, unfortunately, there's a lot of us here that don't necessarily know the full implications of how the system works. So I can only go on my understanding. And you hear that so often in this line.
Yeah.
It's frustrating. And I mean, all we want to do is try to do the best that we can in whatever, obviously healthcare with their kids and well, every different sector. But when you try to contact somebody, and even though they're, really lovely and trying to be helpful, but they aren't 100% confident that they've got it right, there's something wrong. There's
System
something wrong
complexity.
in the
Yeah.
system.
I
The
guess,
system,
I
the
guess,
system is overcomplicated.
well, I was just going to say, I guess there's so much legislation and so many people who've got differing needs that
It's
and
difficult.
especially if you're working in a complex organization like a council, which has
Yeah.
become more complex, that it becomes very difficult if you're the person who picks up the phone to be able to respond in a way that the person on the other end needs. I don't know what the solution to that is, because as we become more aware of other people's needs and the needs of disabled people and people being cared for, legislation becomes more complex. As I don't know, as there's new health treatments, that becomes more complex.
Yeah.
So I'm not sure what the answer is. It might be quite nice for me to do a podcast on that with somebody else
Well,
one day.
I think things need to be pared down to be more straightforward.
Yeah.
I think my the way I look at things is you have a situation and rules and whatever are brought in for that. And then over time, obviously things change, new things come up. But it seems that that initial set package of rules or whatever is added to. And sometimes it needs rewriting from the beginning. I know that's a big thing, but it's like an operating system and patches and whatever. It just becomes bloatware and it slows the thing down. Whereas sometimes you need to scrap it and start again, and I know that's easier said than done, but I think sometimes with something that's got out of control, like it has, things do need to be right. We've got to sort this once and for all. It might be a, idealistic sort of approach from me, but we don't seem, I was dealing with things connected with my dad and his disability 30 odd years ago. It hasn't improved.
Has
It
it
hasn't improved.
changed? Has it changed though, rather than improved? I mean,
Well,
do you
no,
notice
because it.
changes?
Well, we've now gone, or we've gone from children's services, and we've now gone into adult
Yeah.
services,
Yeah.
and that's a scary thing.
Yeah.
We're lucky in that we've got some really lovely, clever, sensible, helpful people around us, which has helped a hell of a lot. And if we didn't have them, it would be scary because I think we would feel on our own. There is an awful lot of that. I mean, it's worked. Some things have worked out really well, but it's two different worlds. But what I find as well, it's very frustrating that there's no different departments don't talk to each other. There's no information passed over.
Do you mean different parts of adult social care?
Well, no, like from children's to adult, you
Oh,
start
I
again.
see. Yeah. Yeah.
It's and I get, you know, I suppose it gets complicated with information being passed, but even like the lady I was speaking to with the council this morning, and it was about council tax, and council tax support and everything. And different departments within that do not talk to each other. Information isn't shared. And you hear this so often right the way through.
It may be, I don't want to get off the beaten track, but it may be because there's been so many cuts and so many staff lost that people haven't got time to speak to one another.
Well, in
Because I
fairness,
know
yeah.
with a different hat on, I find that in other areas, like for example, planning and economic development.
I mean, I can understand. I feel, an element of being sorry for people because in so many different aspects of what carers deal with these days, you're dealing with people that are trying their best, but they are so snowed under with the amount of work they've got to do that they're trying their best, but they just cannot achieve what is needed, really, you know? And I don't mean that to sound unfair, but they've just got too much on their hands to be able to deal with
Yeah,
things.
yeah,
And that's not, I mean, you've got good people in the services without a shadow of a doubt, but it must be frustrating for them because they aren't being able to do the job that they went into that profession to do. Because some people, it's a
mm,
calling, isn't it?
mm,
And
mm.
I know of several people that have been social workers or support workers and that, and they've come out because they've been so frustrated that they can't do the job they went in there to do.
So how's it been over the last 20 years for you and Lisa as um carers and parents? Because it's funny, that label carers, because you're a husband, a wife, a dad, a sister, a daughter, or whatever
Mm.
first, and you would care anyway if a member of your family needed support. But it's kind of with you, you're a dad, it's extra, but it's extra times three, if not four,
Mm.
obviously, with your mother-in-law.
Yeah. Well, I think it's not just the caring aspect, is it? Because that takes up a considerable amount of time to get it right. That's for one person, let
Yeah,
alone for multiples.
yeah,
But it's you become a personal assistant as well.
yeah,
You know, you've got all the red tape. You know, I at times feel I do more paperwork now than when I was running my own business.
yeah,
And you know, fair enough, it's part of the deal. But a lot of it is duplicated,
yeah.
and you wonder exactly how necessary all of it is. Because there are times when you think, you know, this is just dragging everything out. You know, I understand that you can't expect things, and we don't expect everything to land on our laps. You know, I quite enjoy getting involved with stuff, but it's very frustrating when you have to repeat yourself so many times. And you're in a similar position. You know what it's like. It's a case of it's an uphill battle.
But I think
Um,
I think yes, it is, and I agree with you. And I think there are some things. I mean, one of the things that gets me is NHS appointments that turn up through the post. Sometimes after the appointment's happened,
yeah,
or when they could have emailed it, or when it could have
yeah.
been done in hospital. And you think, well, for every one of those at, you know, the cost of a stamp, that's a lot of money being wasted on quite an
This is the
old-fashioned
thing.
system.
For me, I'd rather have something electronic than a
Yeah,
piece of paper. I
yeah,
detest paper.
yeah.
I really do. And in this day and age, you go back to people saying about the paperless office. It's never happened.
But I
People just,
suppose, yeah, I suppose for you as well, because it's now you've moved from children to young adults, that it's not just a case of you getting a piece of correspondence and you and Lisa needing to consider that correspondence and deal with it. You obviously have to, do you have to consult and almost engage with your children and help them understand what it's all about and what the choices are they've got to make?
well, yes, to a degree. And I suppose in a politically correct world, that's what you're supposed to do. But we've got obviously one son who doesn't understand any of that at all,
Yeah.
and another one who, the more information you give him, even to try to make it simple and clear, would give him such anxiety that we virtually drop it on the day because that's what's worked the best for him. And he's achieved a lot. I mean, from somebody who had to be restrained on the floor at one time for teenage boosters, he's got to the point of having COVID and flu jabs on the same day and watch the needles go in. Now, that to me is amazing. But
He was
that's only
always
come about.
He was always
Sorry,
he was always a smashing little lad, though.
but it's
Wasn't
it's such a journey, and but
he? Yeah,
that's only come about by how brilliant people have been in the NHS that we've dealt with.
yeah,
And we've had every extreme.
yeah,
We've had from people in the beginning, somewhere it was more important about them and their position, to now we've got, and we've been through people that are absolutely outstanding. Our doctors' practice, they couldn't be more supportive and helpful, never quibble. But then again, it's that relationship you build up, isn't it? Everything you do, I try to build a relationship with everybody I work with. I take the time to thank them for their time, what they do, the way they do it. And it does pay off. I think old-fashioned values, there's
yeah.
still an awful lot of time and place for
You,
that.
you can't beat a please and thank you.
Oh, no. And I mean, we've, well, to the point when our eldest went in for his first COVID jab, explained the situation, and they got him in on a Saturday morning, half an hour before everybody else, so that it could be what it needed to be and less fuss and everything else. And that's turned him round the corner for injections. You know, one person making a difference can have a colossal effect, and I can't, I mean, Lander Medical Practice, I can't praise them enough.
So in a way,
They're
I mean, it's not what we were talking about just now about paperwork and stuff and systems. It's not about almost technical intelligence. It's about emotional intelligence and knowing how to deal
empathy,
with people, empathy,
empathy.
empathy.
Yeah.
And you mentioned Phil right at the beginning because you were talking about how rewarding it's been. I just wondered whether you could say a bit more about that because I think that's a really nice aspect of all of this.
Well, I it's strange because you don't actually think about it because you just get on with life, don't you? But when there are times, you will just stop and think. Well, I know in the past when I've been doing like DLA forms and whatever, and I know at one time our youngest boy was his DLA award was knocked down, and I phoned up about it to demand a reconsideration. And so she wanted me, the woman there wanted me to reel off what I did for him. And by the time I put the phone down, I was shaking because you don't realize all that you do. And I'm not here to, I'm not a person that bigs myself up or pats myself on the back. But sometimes you lose sight of what you actually do and the good, warm, fuzzy feeling you get, when you get something good happen. Because we've been through with the youngest boy quite a bit over the last 4 years, significant changes. And in the last 6 months, we've seen, well, maybe even 12 months, we've seen little changes of improvement. I mean, it's not going to change his life, but it does give him a better quality. And one of the things he's managed to do is go from liquid and granule medication to now he's all tablet medication. And with what he suffers from, that's quite a massive step. And not only is it easier, we've seen benefits in terms of how his medication is working better for him.
Oh, right, right.
The,
So
the
the form of
feeling,
medication can be better for them then.
well, all I can think of, and I'm not a medical person,
No,
I'm only looking at things in a logical way. But the tablets are getting and breaking down to where they're designed to break down
right.
in the gut and get into the bloodstream. And his epilepsy is, we see, I mean, you get the occasional one that is a bit nasty, but his fits are milder. They don't have as big an effect. And whereas the majority of the time he would have a fit and he would just go to sleep immediately afterwards. That's not happening now. He'll have a moment or two where he's gathering himself, and on he goes again. That's your reward, things going better. Because the last 4 years have been a frightener. I remember going in for a meds review with one pediatrician we hadn't seen before, and his first words to me were, "I'll put you in touch with the hospice, and have you done your end of life plan?"
Yeah.
And it was only a meds review. That there can be complications with things. None of us are silly, but that, I tell you what, I still haven't regained my confidence from that, and that's what, nearly 4 years ago.
Did you, out of interest, when that was said to you, how did you react? Did you get angry? Did you complain about it?
No, I just turned around and said, "Well, who are you, the Prince of Darkness?"
Yeah.
Which is, you know,
Yeah.
it. And I think it dawned on me later, you know. Um,
It seems to be, through my experience, that talk seems to be something they automatically do, not always in terms of context, a bit like a plumber would suck their teeth when they come and look at two bits of pipe that aren't connected. I'm sorry to break it down like that, but that's
no, no,
it.
I
And I,
no,
I think the approach, I really think the approach needs to be different because I was in Trelisk Hospital before Christmas. And I'm not going to say the ward I was in, but there was a person actually next to us who was delivered bad news, and I can understand why because of the context of it. The same talk was given to us, even though the wishes, our wishes, were for everything possible to be done if we ended up in that
yeah,
situation. And I'm not convinced that they listen because this is now the second time we're having to tackle this.
yeah. I think in this particular situation I'm talking about, this guy had a reputation. I found out later for being like that.
Right.
And I've once before come across a registrar when youngest son went in with a chest infection. I think it was chest infection. Might have been blocked bowel and sepsis he had. Either anyway, this registrar turned around to me in the high dependency unit and said, "Oh, how far do you want to go with this?"
Yeah.
And I thought, it's a bit of a, that was the first words, you know? And I said, "Well, all the way, why?" You know, and I'm quite a strong person, but for something like that, somebody who's not as strong could have a devastating effect,
Absolutely, because
you know.
and the only thing I can think of is for them, like using the plumber analogy, it's not just another day on the coal face, to use another
Mm.
analogy. But for the people you're dealing with, of course it isn't.
No, I
It's a
mean,
cultural thing.
I'm a realist, and when you're dealing with disabilities and that, obviously they vary so much. None of us know what's around the corner. I mean, in youngest boy was diagnosed with a really rare condition 3 years ago, and the consultant that told me you couldn't have had a better delivery. This guy had spent 2.5 years finding out what it was that he was suffering from, but he printed stuff off the internet to give me the information, and
Yeah.
he delivered it in such an honest but nice way. And at the end of the day, it's like I said, well, I could walk out of here and get run over by a bus. None of us know what's around the corner,
No.
so we just take every day as it comes.
Yeah.
But this is the thing with everything that you deal with as a carer, it all depends on the person you're dealing with, the job they're doing, how they come across to you. And I suppose you can never get away from that. But the variation in people is quite frightening
Well,
at times.
unless more could be done on the way that people are trained, because I think in organizations they spend a lot of time training people on, equalities or health and safety, but never on how you talk to other
People
people.
skills.
people
Yeah.
skills. And I know,
People
I know you
skills
can say, well, you either have people skills or you don't, but there will be a group of people who, um, if confronted, won't realize until it's put to them that actually they're not dealing with people in the best possible way, or they're not approaching things in the right way. And perhaps just that's neglected.
Well, in lots of different areas, I've got talking to people and all that, and there's an awful lot of situations where people aren't given the training that they require
Mm.
to let alone, well, do the job, let alone deal with people. Some people are naturals. Some people are naturals, and they can deliver lines and everything, and they've just got a gift. But other people, they make things more awkward because they haven't got that, whether it's confidence, to just converse normally or whatever. It's I,
It's also, I suppose it's also a difficult thing as well, because having family experience of the NHS, you can have conversations with patients, especially these days. Yeah, I mean, one of the saddest aspects of modern society is signs up everywhere saying, "Please treat people with respect. They're here to help you." I mean, you
yeah,
wouldn't you wouldn't have to put a sign up like that even 10 years ago. So the medical profession or council workers or whatever have to be quite careful in some ways in what they say, and almost kind of perhaps become passive aggressive to ward off that anything coming at them. And it's just a very difficult age that we live in,
I think it's the way society's gone, isn't it?
unfortunately. Yeah. Can I
Not the better.
Not the best. Can I just take you back, Phil, as well? Because you talked about when you cared for your dad, and that was 30 years ago. How old were you when you started to need to look after your dad in that way?
30, actually. Yeah, I was
Okay.
30.
Okay.
Um, yeah, I mean, that was, well, he had his 60th birthday, and the day after, there was an accident at home and he
Oh,
broke his neck.
right.
Um, yeah, quite pivotal moment in several lives, really, because that sort of thing, you never, we, because, well, in actual fact, back in the 90s, you didn't see a lot of people in wheelchairs, did you? You know, not like nowadays. We had no comprehension of what it took to get somebody in a wheelchair and for them to live their life in a wheelchair. It wasn't a case of, right, well, there you go, we'll plonk you in that wheelchair and that's the end of it. He was 6 months in a spinal unit, um, and 8 months in total, because we had to wait a couple of months after that for him to be able to come out. But yeah, I mean, it was an eye opener, and it's probably led to where I am today. Because it put my life. Well, I went down a different road, and yeah, it like I say, it was an eye opener, but also it makes you aware of what you can cope with, which is what I was saying earlier.
Do you think it
Until
helped
you
it
can't.
helped prepare you in a
Well,
weird
we
sort of way?
spent. Well, I was going up to the spinal unit at Odstock, just outside Salisbury, anything up to 4 times a week. So I did care training and everything there. So there was a lot of preparation. But we just got on with it, you know. I think I remember his primary care nurse. Some of the most important words from her were, "Look, this is how we teach you to do it, but when you get home, you will find your own way."
Yeah.
And there's a lot of truth in that, because
Yeah.
what is straightforward for one person is not straightforward for another. We are different, aren't we?
Absolutely. Yeah.
And I think that's something you learn. It's life skills you're learning,
Yeah.
and it's having the faith in yourself to trust what you feel is right. And that's another thing I've found with, I mean, our youngest boy's been in and out of hospital a lot, but one of the things I've learned is the most important is trusting your gut instincts, your parental instincts as well, you know. And the first time we went in with a chest infection, the doctor on the kids ward got talking to him, really nice Scottish chap, and I had no inkling that there was something wrong, but there was something niggling me that something wasn't right because there were no real major signs. And I just took him up to A&E, and it transpired he had pneumonia, or the start of pneumonia. And this doctor just turned around and said, always listen to your gut.
Yeah.
And parental intuition is one of the strongest things, and we always listen. And I think that's a lesson I learned. And this is it. With everything we've done over the last 20 years with the kids, is well, you learn, don't you? There's no manual to go and read. And obviously, special needs is another thing on top of that again.
And it's partly about how the kids or anybody else you're caring for, how they respond and their own needs, what might be comfortable for them when they're being lifted or whatever. It's not going to be uniform.
No, everybody's a bit different, but and also with having youngsters that don't give you information,
Yeah.
so
Yeah.
you're having to use all your senses and anything you can come up with just to keep an eye on things. And in actual fact, we've got a more senior citizen that it's very, very similar. But it's surprising what we've learned with the boys has helped us do a better job with the mother-in-law, you know?
So, Phil, we were talking about the fact you've got your mother-in-law living with you. So it's three generations. It's almost kind of the thing that a lot of people, middle-aged people, experience about having children at one end and having elderly parents at the other. And
Children at the other end as well.
yeah, sorry.
Children at the other end as well.
Yeah, yeah. So you're kind of almost potentially squeezed middle. How's that in terms of the family dynamic? How does that work? I mean, do you find does like weirdly does mum-in-law do some caring herself? Do the kids do some caring for mother-in-law or
It's I mean, I don't want to say too much to be fair to her, but
fair enough?
yeah, it's an unusual and at times difficult situation because things aren't as she's a little bit of a complex soul, and she's quite Victorian in her ways. So you don't get any information out, and yeah, she's at the moment she's not all well with life. Health wise, she's doing brilliantly for somebody who's got partial heart failure. She's amazing, but with things that have happened in her life, yeah, she doesn't always deal easily with life, um, which is a shame because it should really be a case of being in a good place. But it's yeah, I mean it's hard work. It's hard work.
So it's probably more emotional hard work than necessarily just physical.
Yeah, yeah. I mean, when you're trying to help somebody, but they won't let you help them, you know, barriers go up. It's a
But
hard deal.
it might help her having the youngsters around.
It should do.
Okay.
Unfortunately, there's a lot of detachment from a lot of things. It's something called detachment syndrome, actually. Yeah, it could be a lot different. I think that's where I got to leave it, really. I
Okay,
mean,
that's
it's
fine.
a shame because she came to live with us to try to make life better for her.
Yeah.
Um, and yeah, we take her away on holiday. She's included with everything, but to be helped, you've got to want to be helped, haven't you?
Of course.
You
Yeah.
know.
So
Um, yeah.
I was gonna say, because we've focused a lot on the positives, some negative niggles about dealing with stuff, which I'm sure everyone's going to have. What? I mean, for you, is that kind of the most negative thing, if there's a negative thing about being a carer, or are there other things? I mean, to sort of, and if there are, what are your strategies for kind of dealing
Well,
with
you
them?
know, uh, we live in a world where nothing's perfect. We aren't perfect. Systems aren't perfect. So you really just got to find a way of making things the best they can be. When I'm dealing with any aspect with the kids, I try, and one of my weaknesses is I really struggle remembering names, but I try to get a name so I got somebody to go back to or to refer to.
Do you write
I
it down?
try, yes, I have to write lots of things down. Um, but I'm of an age, so I've got an excuse.
Yeah,
Um,
yeah, you're a bit older than me,
but
aren't
yeah, um, I try to build a relationship with either that person or the department that I'm dealing with. But just treat people with good old fashioned respect and consideration, and that's being completely honest. And yeah, I don't know. I usually find a way. I don't look on myself as being resourceful, but I do find a way to get things sorted. And I do find that I don't jump into things. I take my time and almost take a step back and look on the wider perspective. And sometimes it's surprising how that helps you find another avenue.
No, that's
Or
interesting. Yeah.
I'm not against asking a question, even if it seems like a silly question, because I'd rather look a fool, but I know where I stand with things. And you never know what might come out of asking that question that might not be as silly as you think,
So is that a
you
top
know?
carer's tip about doing your research?
Well, I've never thought of myself as the sharpest knife in the drawer, but I do think I might be selling myself a little bit short. But it is just things I've learned. As we go through life, we learn things. We don't come pre programmed. It's all about education. And it's one of the things I've learned. And if you ask a question, even if it's a no, or you end up laughing about it, at least you know the answer. There's a lot of people that are afraid to ask. And at the end of the day, what's the worst that can happen?
Mm,
You know,
mm,
I
mm.
laugh at myself all the time,
So, so,
you know.
so, so do you when you're sort of doing your research, do you keep records and notes, and you keep a notebook and stuff? Because I find trying to retain all the information. I mean, there's almost like a challenge of having to live your own life and for other people's at the same time, which
You don't live
requires
your own life. Now, that's one thing I will say that Lisa and I have, in many ways, given up our lives.
right.
That's not, playing the violin or anything,
Yeah.
but and especially with adopting kids, you take on, or certainly the way I look at it is, you know, you are taking a real major responsibility of kids that weren't born to you. And if anything, I feel it makes you lift your game even more. That's how it feels anyway. Um,
But presumably you do have to keep physical notes or stuff, because I don't know about you. I think you've alluded to it actually. I'm good at forgetting things or thinking, oh no, why didn't I say that? Or why didn't I do that? Or whatever.
well, we've only got so much capacity to remember.
Yeah.
And as you get older, there's less room to store it. That's the way I look at it. But it must be something like
That's
that,
true. That's true.
you know?
Yeah.
Um, I can remember stupid things,
Yeah.
Really stupid things. But I tell you, if I don't write a name down, as soon as I start speaking to somebody, I've got to ask again.
Yeah.
Because I will not remember the name. I am hopeless. That's just one of my dark, grey areas. But it, yes, I do try to have a contact. But do you know, it's like with our doctor's surgery. Whenever I speak to somebody there, I treat everybody the same, whether it's the receptionist or one of the doctors and anything in between. And I take the time to say thank you for your time and thank you for helping me out, you know? And I do think that people remember that when you talk to them again.
Ah, yeah.
And I don't do it to get anything extra. I'm just being me.
Yeah.
But I do feel that just being kind and considerate, generally it comes back.
Do you notice, is there it's like a big question this, in terms of kind of all of your dealings, would you say that things are more challenging now talking to agencies and authorities now the children have transitioned to adulthood than when they were officially kids?
Mhm.
Or do you not see any difference
Well, we've
generally?
been lucky in that even with a lot of the child services, I mean, we've been quite independent.
Yeah.
We do tend to sort as much ourselves as we can. But we've had some fantastic social workers and family workers from the children's side, outstanding. But having said that, the first one that we had that did the assessment on both the boys turned around and said our oldest didn't meet the criteria. And the next social worker we had for our youngest boy turned around and said, well, who's his social worker? And said, no, he hasn't got one. Oh, why? Oh, wasn't deemed to meet the criteria. And he said, I'm not having that. He said, leave it with me. I'll sort it. So, you know, there's such a variation in what you get.
In an
Um,
Go on, Phil. So go on. I
now
was going
you
to say,
asked the question because
all right.
carry on.
I was going to say, what does an ideal world look like? Leaving aside, your skepticism about getting to that, but what do you think could be done to improve the lot and support for carers, either generally or specifically to yourself?
I think things just made simpler.
Right.
I think it's like things are just bloated out of proportion, and there's so much jumping through hoops. And I think sometimes even the people you speak to, the systems are so complicated they don't necessarily know the best avenue to go down themselves. And I've seen that with social services. I've seen it with that's both adult and children's, even to the point of ringing up and trying to find out. We had a hoist pack up and ringing the number, and the person on the other end, oh, I don't know what I'm supposed to do, and it's. I think in general things just get too complicated, and
Do you think that might, I mean, we were talking about complexity earlier. Do you think it might be as well that there's more gatekeeping because there's less money around?
obstacles put in the way. Yeah, without a shadow of a doubt. I mean, it's been done forever and a day.
Yeah.
I can remember just over 30 years ago, my dad, he couldn't do anything for himself. The only thing he could do was use a page turner, which you used to use by blowing or sucking on a straw. And we just asked if it was possible through social services to get one. Comes back, the social worker, no, there's no money available and everything else. And bearing in mind, we didn't really ask for anything else. This is the one thing for him to have something independent. The head of the Clay area nurses at the time was really incensed with that and took the social worker to task. Within a month, he had page turner.
That's
Now,
better. Yeah.
if there wasn't the possibility of having it,
Yeah.
it wouldn't have happened. And I do wonder, and it's not to have everything, but you know, it shouldn't be down to somebody either not wanting to chase something up or to fight for something for somebody. It's either a yes or a no. Either there are funds available, but you might not get it for so long, or it's not possible. You know, it shouldn't be people that are in any position to help others. It should not be that they can't be bothered. And that was a situation. I mean, we've got people now that are going above and beyond helping and finding ways to do things. And you appreciate what they're doing even more. You know, I don't want to mention names because they
No, of
probably
course
do
not.
too much, you know, but I really appreciate, and I take the time to say thank you, because you do come across people that either they've got too much on their plate to do, or they shouldn't be in the job. You know, there's always that element. But I have to say that there's elements that haven't changed in 30 odd years. It's still the battle, and it'll always be a
That's
battle.
interesting. What about carers allowance? Do you think that's adequate? Do you think that should be increased?
Well, I think the whole thing is complicated, isn't it?
Yeah.
Because, you know, well, last year we moved from child tax credits to universal credit. That was a problem in itself because in the transition we lost council tax support and everything because they don't give you enough information on how things are worked out. And it's only going through it and mistakes being made that you learn. But also, if you're trying to improve a situation, and let's face it, anything with disabilities involved is expensive. And I don't expect there to be the ability to have everything because, we're living in the real world. But you're penalized if you try to save to do something, because if you go over a certain threshold, then you end up being given less money.
Yeah.
So you're trying, I mean, it's not about having a cracking life and, living the life of Riley. It's trying to do something that will better somebody's quality of life that you're looking after. But because if you try to save up to do something and you go over that threshold, you end up being getting less money every month. So I suppose it's difficult to have a perfect scenario, isn't it?
It is. It is. I just.
But
I
it's
just.
also
Go
it's
on.
also frustrating when, when we started out and when I became a full-time carer, which is over 15 years ago, we invested everything in the kids' future. But everything is so expensive, and it's like you're trying to improve things for them and not, you aren't asking for everything to be provided, but you're being restrained because in some areas, because you're trying to save for a particular item that is expensive, but you end up being given less money because you've saved something to go towards something. It's but then how do you fix that issue?
Did you realize at the time 15 years ago, did you think at the beginning, did you think I can carry on working and caring, or did it become really clear that you had to make a choice?
Well, the intention was when we started out on the last well, before we'd even had a work, because on our second adoption there was an awful lot of off the record talking about what ended up being our last adoption. And my first words to our social worker was, because we bumped into number three in his educational placement by accident, really. And I was on the phone to social worker within an hour. And I said, well, look, being totally honest, I really don't know how it's going to come about, because I don't know how Lisa's going to cope with three, and especially two disabled boys. First thing in the morning when I'm out doing my contracts, oh, she said, that's easy. She said, you'll have to give up work. And you could have knocked me down with a feather, because that wasn't in our line of thinking at all. And I found that really difficult, giving up work. Not the caring side of it. I love what I do. But I found it difficult not going out and earning my own money. And people that do look after, they do the caring and they go out to work, take my hat off to them, because I'd love to be able to do it, and it would be a bit of a break. But I couldn't manage it, because I feel like I'm running on empty all the time now, because you don't sleep properly. You got broken sleep and everything else, and I wouldn't change it for the world. But I do. It was a real shock to be told that. But then again, looking at it, it required that sort of commitment. Because
I think it's very topical what you're saying at the moment, because and we're not going to discuss politics, but I'm gonna say this: the government at the moment is very keen to get people back to work and off sickness and other benefits. And one of the questions I would ask is, how do you do that when people have caring responsibilities, for example? Because it's a cost benefit analysis. If you're a carer, you are actually saving the health and social care system a lot of money every year. If you can't look after that person because you're working, then somebody else is going to have to step in and lolook after that person.
And that's going to be more expensive.
Exactly. And also the other thing is, those people don't actually exist, because ever since Brexit, the number of, there wasn't as many people from the UK who were home visiting carers before, and they were topped up by EU carers. Those people are now gone, and they're having to recruit people from Africa. So the whole kind of care, kind of almost kind of career, if I can say it, perhaps going into the health service, it isn't there, and it's complicated and expensive and difficult for care employers to be able to employ the people they need. So all these things are interrelated, and it's another example of a complex
Oh,
mess.
it's a minefield, because
Yeah.
we've had, our youngest boy used to go to Luana, the Red Wing, the children's side, and then they shut that down. So then we got moved over onto direct payments. And we had an agency to start with that was sorted out by the then social worker, who he was a really nice chap. But we found out further down the line that person with that agency was taking our youngest son on her hospital appointments, when she should have been spending the time doing what was necessary for him and doing her shopping. And then we got another person working for that agency. She took over, and she's been brilliant. And then she came on with direct payments with us. And we are now in transition of, she wants to retire, hopefully this year. That's her words, not mine. And we've had a mother and daughter, and the mother's been seeing my mother-in-law, coming in from my mother-in-law 2-3 times a week. And they're now slowly, as they get the hours free, they're taking over with the boys. And the biggest thing with that is finding the right people, because there is, the care industry is so poorly paid that it's either people that just love doing it that do it, and they aren't really so bothered about the money. Obviously, they still got bills to pay, or it's people that aren't really interested in it and they shouldn't be doing it anyway. You know, we are. I don't know how we've been so lucky to fall the. You know, for the three people we've got working with the boys at the moment, we've fallen on our feet and we haven't had to go looking for them because it is a nightmare trying to find the right people. But you can't find the right people generally because the money's not there, you know, and especially with the cost of living crisis, because it's you find that the right people do it because they want to do it. You know, they have that natural empathy, understanding, care, and nature, and it's not just we'll go and it's easy enough, we'll go and do that, you know, and they don't really care some people don't care what they're doing, you know, they shouldn't be there.
No.
You know, that's a harsh thing to say, but it's true.
Then because there's nobody else available, there's no choice.
Well, that's it, you know, and it's a shame because it's such a rewarding profession in terms of feeling good about what you're doing, but financially it's not, is it?
No.
You know,
I think you've hit the nail on the head there, because if people are doing a job where they're making a difference to other people, and that difference is tangible through smiling faces, then they should be rewarded for it.
Yeah, I mean, well, when you see what some people get paid, and you know, for falling asleep in the Lords or whatever,
£332 a day.
Yeah,
that is.
The world's not a fair place.
No. Well, I always use if I ever see like a Premiership footballer earns X amount, I always say no, he doesn't earn X amount, he gets X amount. What you get and what you earn are two different things.
Yeah, definitely. You know, you can't blame people, you know, for what somebody is willing to give them.
Yeah.
But when you look at how hard some people work, and what they get in return, it's disgusting. You know, because and fundamentally, we are trusting these people, whether it be with an elderly relative or, you know, really young children, whatever it is, there's massive responsibility. And it goes unrewarded, really. You know, you're better off going into a supermarket and filling shelves.
Yeah. Well, that's the thing. I got a feeling that actually, if you do fill shelves in a supermarket, you get paid a little bit more, and that is probably the essential problem, because they can. I mean, you know, they can afford it. Care generally can't. Although I think there are big profits in care companies. That's another podcast.
There are in some places, but the profits, the money's going in the wrong direction.
Absolutely, yeah.
But everything's about profit now, isn't it?
Yeah.
It's not necessarily about service.
Yeah.
It's, you know, it's what's creamed off the top, isn't it?
Yeah. I was going to ask you, Phil, as well about your hopes for the future for the kids.
Yeah, well, obviously, somewhere down the line, we're going to have to approach supported living. I'm hoping that's a long way down. You know, I've got a target where I would like to reach before I'd have to think about handing over. But I suppose ultimately we'll have two young boys, everything being fair and a fair crack at good health, that will require supported living somewhere, you know? So that'll be another nightmare sorting out.
Well, that'll be another big transition, but if not a bigger transition point for them.
Yeah. And obviously we've got a daughter who all needs support, but in setting up for her to have a good life, you know? But putting it simply, I just want them to be happy.
Yeah.
Happy and healthy. That's But the sad thing is, yet again, for the boys, that's going to be expensive one way or another.
Yeah.
But and you do wonder. I mean, I used to, when I used to do my private hire, I used to get involved with some of these places that were originally NHS, but I think they went over to things like Barchester and whatever. But yeah, we got to go down that route. I mean, we've always had half an eye, in that direction, because you've got to have some sort of plan, even if you don't know how you're going to get there. But yeah, we've got to. In actual fact, when they get to be 18 and adults and having to do the power of attorney stuff or the deputyship and all of that, it's such a flipping nightmare. And this is another thing, you've got whatever is paid to the kids and that when they're kids, and their situation doesn't change when it gets to adults, but there's a lot less money to do what you're trying to do, and you've got to be quite creative at times. But where there's a will, there's a way.
Yeah. Well, it's another carer's skill. I mean, budget. I mean, people actually. I mean, it's interesting. I don't know if if carers are out of the labour market for a long time, but if people who are carers re-enter the labour market, they've got an awful lot of skills that could be really useful.
Massive.
My goodness.
Massive.
Yeah.
In actual fact, if they were paid relative to their skill, they would be financially very, very well rewarded.
Yeah.
But they aren't, are they?
That's a good place to finish up, Phil. I'd like to thank you for your candor this afternoon. You've been really open and honest. I think it's been a really wide-ranging conversation about lots of different topics, and we've gone from the personal to the political and back again. So I think a lot of people will get a lot out of what you've had to say.
Well, I would like to think so. At the end of the day, I think until we all start talking more, nothing's ever going to go anywhere, is it?
Well, that's what these podcasts are about, because they do get some viewers and readers and interaction, and hopefully it helps people. People can start to see some common threads or issues coming through the people I interview.
Well, even if it makes people feel less lonely.
Yeah.
Because it can be a very lonely place, can't it? I mean, we're lucky that we're both full-time carers, so we've got each other around all the time. We don't necessarily do a lot together because we're tied up. But for us, I mean, we made a choice. Yes, it's rewarding. But for anybody out there, talking is the most important thing. Because,
and of course, people don't always have the choice either. That's the other thing.
No,
not to sort of take away from, because a carer is a carer is a carer. But one of these things that podcasts are doing is showing, the different circumstances, which I think is good, because you don't want adult social care or a politician or someone saying that group, they're carers. Because actually, it's a very diverse group of people.
Very much so.
Yeah.
And people go into caring for so many different reasons. It's like, all right, we made a choice. Some people don't have a choice.
Exactly.
It's something, an incident or something will happen, and your life changes. And I mean, I've experienced both of those things. But the most important thing really is that no, you aren't on your own. There are people out there, and there is support out there, even if it's perhaps not, financial support. It's emotional support, and that's as important as anything else.
But I can finish the podcast by saying that it's an absolute honour to know you and Lisa, and those 3 kids, and what you've done for them over the last 20 odd years, and they're smashing kids. And more power to you, Elbow. And I can say that publicly here.
Well, I thank you, Steve. I mean, we both feel we've been very lucky. It's not something. It's not the norm, but it's special.
Yeah.
And whatever we've given them, they've given us back.
Yeah. I'm sure.
Life is a two-way street.
Yep. And as long as you're not going up a one-way street with traffic coming towards you, you're okay.
There have been times, but that's another story.
All right, Phil Dunstan, thank you very much for joining me. Take care.
My pleasure, Steve. You take care.